talk about COVID-19 in communities of color, what we're really talking about is access, trust, and equity, right? These communities aren't just hesitant, they've been overlooked, and they've been victims of misinformation, disinformation, just like many other communities, right? And people want to protect themselves and their families, but the barriers to the vaccines are real, as well as the barriers to reliable information about the vaccines. And so it's easy to look at the numbers and think, why won't people just get vaccinated, right? Like, why won't they just accept it and see for what it is? But if you're in a community where transportation is an issue, where there's only one clinic for thousands of residents, and where language barriers make accessing information difficult, where if you go to a clinic, everything is essentially in hieroglyphs, it's very difficult to be able to accept that vaccine since you're not familiar with it, and the information coming to you is not as reliable and saying things that are not trustworthy. And for people who've been historically mistreated by the healthcare system, we can't ignore that this mistrust plays a huge role.